Hello, everyone. This is Lori Lindberg, Project Manager of the Reframing Aging Initiative. On behalf of the Reframing Aging Initiative team on the call today, I'm pleased to welcome you here to the webinar where we will be learning about the prevalence of everyday ageism and the ways that ageism can affect our health. We will be zipping through this research kind of quickly because we only have 30 minutes for this webinar. But I want you to be listening for some of the cultural models from the swamp of aging in this data. Before we get to our presenters today, I would like to remind you of some housekeeping items. All attendees are in listen-only mode. For questions you may have, please write them into the question box located on the control panel on the right side of your screen. This webinar is being recorded and it will be available on the Reframing Aging Community online networking platform in 72 hours and on our webpage. Also, there will be a survey immediately following the webinar, so please take a minute to answer the survey questions for us. It is my honor today to introduce our presenters, Dr. Julie Ober-Allen and Dr. Erica Solway. Of course, I'm so pleased to say they're both GSA members, but they also have other affiliations. Dr. Allen is newly at the University of Oklahoma, and she still holds a faculty position at the University of Michigan. And Dr. Solway is the Associate Director of the National Poll on Healthy Aging at the University of Michigan. Welcome, both of you, and thank you so much for being here.
Thank you, Lori. It's truly our pleasure to be here with you today. We're very excited about this opportunity to talk about our recent work on everyday ageism and health. Thanks, Julie, for advancing the slides. So I wanted to start by giving you a little bit of background about the National Poll on Healthy Aging. I want to spend most of our time focused on our results, which Julie will share with you. And if you do have any questions, please feel free to use the chat box or hold them to the end, and we're happy to answer them. But in terms of our goals for our work more broadly with the National Poll on Healthy Aging, our first goal is that we attempt to develop, implement, and sustain a recurring nationally representative household survey of US adults aged 50 to 80. So this is something we do on a regular basis. We've released 25 reports in the past 3 years since the poll has been in existence. Our age range is 50 to 80, and I'm happy to talk a little bit more about why that's the case. But what's really unique about the poll is the opportunity to get the opinions and perspectives of older adults themselves about health and aging related topics that matter, that may be misunderstood or not fully explored from the perspectives of older people. And our second goal is to disseminate these results as widely as possible through multiple channels. So one of those ways is through our National Poll on Healthy Aging reports. I will show those to you, and they're available on our website at www.healthyagingpoll.org. But we also use other channels as well. As academics, we publish our results in academic journals and in other formats such as blogs that journals offer, which may be more likely to be seen by policymakers or other policy-oriented audiences, because our third goal is to reach a variety of audiences. We really want to make sure that we're getting our results out to older adults and their families themselves, but we also see our primary audiences being healthcare professionals and policymakers. So we use a wide variety of channels, communication strategies to be able to reach those audiences as effectively as possible. We also do a lot to reach out to the media so that our results can be shared as widely as possible. These are some examples of the media presence we've had through the National Poll on Healthy Aging. This particular report, which we're talking about today, which was released in mid-July, on July 13th, was actually cited by several prominent news sources, including the Washington Post, Health Day, Michigan Radio, Next Avenue, and the Los Angeles Times. So we're really grateful for that coverage. And to tell you a little bit about our methods, so these methods, again, they exist across all of the work we do on the National Poll on Healthy Aging, but also I'll speak specifically to our methods as they relate to this particular study or poll that we conducted. So our surveys are conducted using what's called the Ipsos Knowledge Panel, which is the largest online national probability-based panel in the US. We survey older adults ages 50 to 80 approximately 2 times a year, and we achieve a sample size of at least 2,000 respondents. The sample is weighted to reflect the US population, so we're able to speak to the experiences of older adults in a nationally representative sample, so we're able to talk about older adults themselves rather than speaking just to the results of our respondents. Our completion rates are quite high, typically around 70% among those panel members who are contacted to participate. In this particular poll, we had a completion rate of 77%, and we ultimately achieved a sample size of 2,048 respondents. These surveys are completed online, and internet access is provided to those who lack it. So obviously there's some challenges with internet-based surveys, especially for an older population, but Ipsos provides a lot of opportunities for people to be able to participate by providing them with the internet access and the devices necessary to complete the surveys. They also, the really terrific thing about the online format is that we're able to get our results back very, very quickly. So we're able to be pretty nimble and timely in presenting our results and sharing them with the public. I wanted to now talk a little bit about how we decided to explore the topic of everyday ageism and health. So one of the great things about the poll, we have a partnership with AARP. They're one of our sponsors, and we work with AARP, with our faculty in the University of Michigan Institute for Healthcare Policy and Innovation, with stakeholders, with people we hear from through our website, through reading news stories, and we really try and identify those topics that we feel could really benefit from being explored from the perspective of older adults themselves. So often when we hear about important health or health policy or healthcare related topics, we're hearing about them from other people, not from the older adults that some of the decisions that are made might impact. And I think that's especially true when we talk about ageism. We think of ageism, or if we think about ageism at all, it's often something that we aren't tying necessarily to health. And so in reading about the topic and thinking about how we might explore it, we figured that there was a really important contribution the poll could make to talking to older adults directly about their experiences related to ageism. And we really wanted to focus not just on ageism as we think about related to discrimination, prejudice, and stereotypes, but also to those day-to-day interactions that people might have that may impact their health and well-being. And in doing a little bit of research into this area, we recognized that there wasn't a lot of literature on this topic, and that developing good questions was going to be a challenge for us. And so what's often the case is we utilize the expertise of folks within the University of Michigan to help us refine our questions and to develop and disseminate our poll reports. And in this case, we were able to connect with Julie, who had done excellent previous work in this space. And Julie worked collaboratively with our National Poll on Healthy Aging team to develop questions that we felt really could get at the issues of, what are people experiencing as it relates to everyday ageism that they may or may not identify themselves as ageism, and how might that impact their health and well-being. So I'm going to let Julie kind of take it from here. And again, I welcome any questions at the end.
Well, thank you for that great lead-in, everyone. And thank you for the opportunity to present our work and share some of the directions that we're going in. And I'm really hoping that you will find that some of the information that we share with you is really relevant to your work, and then it will provide you with some tools that you can use in some of your own outreach and communications to develop some persuasive messages on why we need to pay more attention to ageism and to some of the language that we use in discussing aging and age-related issues. So we know that major incidences of age-based discrimination, things like being refused an organ transplant because you're too old, being pushed into early retirement even if you don't want to, being discriminated against in housing, these sort of major incidents, we know that they can negatively affect the health and well-being of older adults. Yet older adults also experience these sort of less momentous but still harmful experiences with ageism in their day-to-day lives. We refer to these as everyday ageism, and we believe that these are also harmful for health. And as Erica had shared, one of our objectives was to really start collecting some data so we could test how strong these sorts of relationships might be. So there's actually a lot of research on other forms of everyday discrimination, everyday racism, everyday sexism, sort of these everyday incidents of homophobia and their negative effects on health. But there is very little research out there that's really looking at how these sort of everyday incidents, someone makes a joke about aging or wrinkles, you see something in a magazine that suggests that older adults are unattractive, how these sort of seemingly minor experiences with ageism may affect health. And so that was the motivation for this work that we're doing. In addition, the research that is out there is very much lab-based. So older adults are recruited to go into a lab. They participate in some experiments. And not to say that this work isn't important, it absolutely is, but we felt that it was really an opportune time to really look at this more at a population-based level. And the National Poll on Healthy Aging, because it's a national sample, really allowed us to do that. So it was a great opportunity to collaborate together and do some really important work. So one of the goals of this work was to capture everyday ageism and separate it from other isms, racism, sexism. What we find when people answer surveys about this sort of everyday forms of discrimination, they tend to attribute it to aspects of their identity that are particularly salient, and particularly those that they've experienced their whole lives. So if you are a Black woman and you experience discrimination, even if it is related to your age, you're more likely to attribute it to your race or to your gender because you've been experiencing discrimination on those aspects of your identity your whole life, whereas ageism affects people only later in their lives. So we really needed to craft some questions that could really tap into ageism. And all of these questions are self-report. And so one note about that is that our numbers are probably conservative because in answering these questions, we're asking people to identify experiences of ageism that they may be experiencing. And it could be particularly because ageism is so commonplace and so socially condoned that to a certain extent, people don't even notice. You know, someone makes a comment about, oh, you probably can't hear this. Let me turn the volume up for you. And they might not even sort of make the connection or even realize it's happening. And so one thing that I just want to sort of share with you is that even though the prevalence of everyday ageism that we're going to share with you is high, in reality, it's probably higher because it is based on self-report. And in all likelihood, people experience more everyday ageism than we were able to capture in our survey. So hopefully you can all read this. If not, it is in our report, and we'll share more information on how to look at that later in the presentation. But these are just some examples of some of the questions that we ask older adults. Is feeling lonely a part of getting older? Do people assume you have difficulty with cell phones and computers? Do people assume you have difficulty remembering and understanding things? Do you see, hear, or read jokes about old age, aging, and older people? So first, we wanted to ascertain, how prevalent is everyday ageism? How many older adults between the ages of 50 and 80 are experiencing it on a regular basis? So we asked them to report how often do you experience those different items that I just showed to you? Do you experience them often or sometimes? And what we found was that 82% of adults between the ages of 50 and 80 report that they experience one or more forms of everyday ageism in their day-to-day lives. Either they reported that they sometimes or often were experiencing at least one. We grouped the different questions that we asked into a couple different groups. So some of them were really capturing exposure to ageist messages. Some of them were capturing Ageism in interpersonal interactions, that's when others make assumptions about you just merely based on your age with no other information. And then others really looking at internalized ageism, so personally held beliefs about aging and older people. And we found that all of these were pretty common. Most common was exposure to ageist messages, which was reported by 65% of the participants in our study, followed by ageism in interpersonal interactions and internalized ageism. So we were also interested to see if some groups of older adults experience more everyday ageism than others. And what we found was that 2 in 5 older adults, so 40%, reported that they often or sometimes experienced at least 3, if not more than 3, different forms of everyday ageism on a regular basis, so either often or sometimes. And what we found was that these higher experiences of everyday ageism were more common amongst the older half of our sample, so those between the ages of 65 and 80 when we compared them to 50 to 64-year-olds. Women reported more everyday ageism, as did those with lower annual household incomes, retirees compared to those that were currently working, individuals living in rural areas, and this was certainly interesting, and we'd be happy to talk about this more during the Q&A. Individuals who spent more time viewing media reported significantly more everyday ageism than those who spent less time with media. So looking at magazines, trolling the internet, watching TV, things like that. So in addition to determining sort of what the prevalence was ageism and who was more affected by everyday ageism, we really were interested in seeing what types of connections we could identify between ageism and health. So this is just pulling from some of my work. I consider ageism to be a chronic stressor, because when you're an older adult, you're going to be experiencing some of those different things that we asked about. People making jokes about aging or wrinkles or gray hair, individuals assuming that maybe you're having trouble with your phone merely because of your age and not for any other reason, that people try to help you with things when you don't really need their help, that older adults experience these things so often, so frequently, that it becomes a source of stress on their bodies, and it actually affects them not only sort of mentally and not only sort of their well-being and quality of life, but that it also affects their bodies and may actually contribute to accelerated aging, increasing risk for poor mental and physical health outcomes. And so it was really important in our work that we both looked at relationships between everyday ageism and mental health, but also looking at other aspects of physical health as well. And this is what we found. Older adults who reported more everyday ageism had worse physical and mental health. And this was across a number of different health outcomes that we looked at. Those who reported that they experienced 3 or more different forms of everyday ageism, so who answered that they often or sometimes experienced 3 or more of the 9 different questions that we asked about. They were less likely to rate their physical health as excellent or very good. They were more likely to have a chronic health condition like diabetes, heart disease, cancer, things of that nature. Again, they were less likely to rate their mental health as excellent or very good, and they were more likely to report symptoms of depression. Now, we can't ascertain causation, so we can't necessarily say we know everyday ageism is causing these health problems in this type of survey. But the fact that we found these relationships very consistently for every health outcome that we evaluated suggests that there is some sort of relationship and that we can't ignore it. One of the other things that we also wanted to do was really look at positive views on aging and how they may sort of factor into this whole situation as it related to everyday ageism and health. So we asked the participants in our poll 4 different questions. We asked them, do they feel more comfortable being themselves? Do they have a strong sense of purpose? Do they feel more positive about aging than they were anticipating when they were younger? And do they think their life is better than they thought it would be? And what we found is overwhelmingly, while everyday ageism is incredibly common and pervasive, so are positive views on aging. And what we found was that older adults who reported more positive views on aging reported experiencing fewer forms of everyday ageism, and better physical and mental health. And in fact, those who agreed with sort of all 4 of these different items were less likely than those who reported fewer to be in excellent or very good physical health, as well as to evaluate their mental health as excellent or very good. So I know that many of you are doing community outreach, you're talking to policymakers and others in positions to really have some influence on narratives and decisions that affect older adults and aging in this country. And so I wanted to give you some talking points that you can use in your work. So everyday ageism is common. And I know we've already talked through all this, but according to this national poll, which is supposed to represent the population in the United States, the way that we weight participant characteristics, 82% of adults aged 50 to 80 reported that they regularly experience ageism in their day-to-day lives. And 2 in 5 experience 3 or more forms. Another important point, everyday ageism appears to be bad for health. Older adults who experience more everyday ageism had worse physical and mental health across multiple different areas that we looked at. Positive views on aging may be protective. 94% of older adults held positive views on aging, which were associated with less everyday ageism and better mental and physical health. And finally, and I think this is summing up our entire presentation and some of the motivation behind our work, commonplace, seemingly minor comments and assumptions about aging may be more harmful than people realize. So to wrap it up, I'll just turn it over to Erica, who's going to just give you a little bit more information about how to reach out to us and look at some more of our results.
Great, thank you so much, Julie, and thanks for sharing those key takeaways. We're eager to answer any questions you may have, but if you have any additional questions or want to explore our National Poll on Healthy Aging work more after this webinar, we really welcome you to do so. We have an email address, healthyaging@umich.edu. You can find that email address and all of our reports and other content on our website, which is, again, www.healthyagingpoll.org. We have an email list that you can subscribe to receive our reports when they become available. So again, as I said, we have reports coming out every month or 2. So we won't inundate you with email, but you would be the first to know when our reports do come out. And we also have a presence on social media, so you could follow us on Twitter. But I think and I should have noted too, on our website, when you go to this reports page, you'll be able to see our questions that we asked, and also to view the press release in addition to the content of the report, which is fully downloadable and can be shared within your network. So I wanted to just open it up to any questions people may have about the poll or about these results.
Great, this is Lori. Thank you so much, Erica and Julie. That is fabulous presentation and so interesting. We have a lot of questions that have come in. We won't be able to get to all of them, but we're going to try. So let me ask, one of the questions came in actually talking about the physiological impact of the stressor. The question is the physiological association between ageism and is it about cortisol levels or other markers of bodily stress?
Oh, you're bringing up my favorite topic. So a lot of my research is looking at cortisol and other stress hormones. That is what we theorize as the physiological mechanisms. There are actually, and we're constantly learning more about this. This is really a cutting edge area of research. We're finding that stress affects the body and a number of bodily systems. So cortisol is just one, but cortisol is a regulating hormone, and it affects and sort of turns on and turns off a lot of other physical processes. But you're absolutely on target. We believe, and certainly there's animal studies and lab studies that provide a lot of evidence to support this, that when people experience these minor stressors, someone insists on carrying your groceries when you're perfectly capable of carrying your own groceries, that people have a physiological response. They have that, maybe a lower level, but a fight or flight response. And the issue with everyday ageism is because it's so commonplace, you may have 10 incidents like this every day. And it's not just from strangers where you could just sort of write them off and say, hey, I don't care. There was an ageist bagger person at the supermarket. Everyday ageism, a lot of people experience it with their friends, with their families, with their healthcare providers, with people who they care a lot about and who they want to be invested in their health and well-being. And yet they're still perpetrating some of these sometimes very caring behaviors and actions, but they can actually negatively affect people's health. So what we believe is because the stress systems, the biological stress systems, become activated so often over the course of a day that they stop functioning optimally, and people stop actually being able to generate a healthy fight or flight response because they're doing it so often that it sort of wears their body out. And over time, we believe this increases risk for morbidity, for mortality, contributes to premature aging, and is pretty consistently associated with premature mortality as well.
Great, okay. I don't really want to say thank you for that because it sounds pretty dire, but I see what you're talking about. So here's an interesting question. It's kind of what is the difference? What we're talking about here is the difference between everyday ageism and experiencing ageism every day. Do you see that? Is that the difference you're trying to get at with this research? Does that make sense? Oh, you guys are all muted. Sorry, I can see that you're all muted. You're probably trying to answer. Okay. Julie, are you going to answer?
I will answer that. It's an interesting question, and I might have to give that another moment of thought. I think it's a little bit of both. So the idea with everyday ageism is related to the frequency, and not necessarily quite literally every day, although perhaps some individuals are experiencing it every single day. But it's both the frequency and the extent to which they are sort of this vague and sometimes sort of hard to put your finger on forms of discrimination. So one of the issues that we're really interested in this field is that there's differences between perceived discrimination and actual discrimination. So someone may do something and they are not intending to discriminate, and maybe objectively, maybe they aren't. But the fact that someone feels discriminated against, that is still going to affect their body. So to a certain extent, intent doesn't even always matter. And so it's sort of these small incidents where, are they discriminating against me because of my age, or is it for some other reason? And you don't know, but it still takes cognitive capacity. You're going to ruminate on, this negative experience you had, and maybe you don't know if it's related to your age or related to your sex or for some other reason, but nonetheless, it still is going to affect your health, particularly if these things are happening on a regular occurrence. So I hope that answered your question, but it is an interesting one, and I'm going to have to think on it a little bit more.
Yeah. Here's a question. Some people have been asking about breakdowns among subgroups in the population that responded to the poll. For example, under positive aging, what was the age breakdown in the answers about the people who answered positively? And then also, did you see racial or ethnic differences in subgroups answering the questions?
So we have looked at it broken down by age, although I would have to refresh my memory on that. But if we receive an email about that, I can definitely go back and look at the data on that. In terms of breaking it down by some other demographic characteristics, there's always some risk in doing that. Even in a survey of this size, we do try really hard to get significant sample sizes of, for example, racial and ethnic minorities. It is always challenging. And So we haven't broken it down by that, and we probably won't, because we can't really do it with any assurance that our findings are accurate. It's certainly a very interesting consideration, particularly given that many people are marginalized along multiple different aspects of their identity. So if you're a woman, if you're low income, if you're a person of color, in addition to being an older adult, chances are these types of discrimination that you're experiencing, they're not additive, they tend to interact. And so what we see is that a woman of color experiences more discrimination, or I should say an older adult female of color experiences more than if we just added the amount that was experienced by a woman, by a person of color, and by an older adult. But it certainly is a very interesting question. There may be some really interesting opportunities to look at that in the future, and we're really excited about that.
Good. You know what, I have to say we have to end now. Unfortunately, we've still got more questions, and we will get to those questions and post them on the Reframing Aging community. But so unfortunately, I've just got to say thank you so much right now to Julie and Erica for sharing your knowledge and expertise with us. We appreciate it so much, and we would like to continue the conversation with you. Just want to note that the webinar recording and the slides will be posted to the community and to the Reframing Aging Initiative webpage. And also, Erica and Julie have kindly given us some slides that facilitators can use when we are doing presentations and workshops. So I'll be posting those on the community as well. Just want to make a note for facilitators listening in that our next meeting is September 15th at 2 p.m. Eastern Time. So please make a note of that on your calendars. And finally, just take a minute to complete the survey at the end of this webinar. And with that, we're going to now say goodbye and thank you so much for joining us today.